A pleasant day to all examiner. My name is Muhammad Yasin Taha. I am a candidate for Master of Science in Molecular Medicine. Today I'm going to present my project proposal, which is titled Exploring the Phytochemicals as Gingipain K inhibitors in Alzheimer's disease. And this is a silico study for pharmacokinetic approaches. My supervisor is Dr. Chung Sui Lee, and the co-supervisor is Dr. Liu Yan. I'm going to discuss all these points. First, I will start with the study background. Alzheimer's disease is a neurodegenerative disease which accompanied by memory loss, decline in cognition, and also neural death. Despite all extensive researches, the current treatments primarily focus on only treatment or just relieve the symptoms without tackling the disease progression. P. gingivalis has been identified as a key pathogen in periodontitis, and it also has an important role in Alzheimer's disease. The virulence factors is Gingipain K, known as KGB. It's responsible around 85% of the protease activity of this bacteria. KGB is lysine-specific protease contribute to accumulation of beta amyloid and phosphorylation of tau protein and also neuroinflammation. So targeting KGB, it will be a promising therapeutic to mitigate Alzheimer's disease progression. Problem statements, conventional antimicrobial show limited efficacy, and it may just disturb host microbiota. Synthetic KGB inhibitors are promising, but may present toxicity and bioavailability challenges. So there's a need to identify natural phytochemicals inhibitors that can easy to penetrate the CNS and have optimal pharmacokinetic properties. Significance of the study. First, we need to provide insight into oral brain axis and link between periodontitis and Alzheimer's disease, supporting also drug discovery efforts using natural products, promote cost-effective and computational efficient approaches for screening CNS targeting compounds. For the objectives, first, predict the pharmacokinetic properties of phytochemicals compounds using in silico ADMET tools. Second, we need to evaluate drug likeliness and CNS penetration to prioritize potential KGB inhibitors for further validation. Literature review. The significance of KGB in Alzheimer's disease pathology has become more evidence. So gingipains, include KGB, have been found in post-mortem brain tissues of Alzheimer's disease patients and are often localized with characteristic features such as fibrillary tangles and beta amyloid plaques. Many studies indicate that phytochemicals are increasingly relevant for combating Alzheimer's disease due to their actually anti-neuroinflammatory, anti-amyloid, antioxidant, and anti-phosphorylation effect on tau protein. Specific plant bioactives compound have demonstrated the capacity to prevent and halt the progression of Alzheimer disease. In silico studies such as molecular docking and pharmacokinetic modeling are increasingly used in drug discovery. They are enabling us to predict the binding affinity, drug likeliness, and ADMAD. Besides, and we can also predict side effect and toxicity. Research question: which phytochemicals meet CNS pharmacokinetic and physicochemical criteria? The second is how can pharmacokinetic parameters be used to rank candidate phytochemicals for Gingipain K inhibitors? The null hypothesis is some phytochemicals will not exhibit favorable PK properties and CNS penetration, while the alternative hypothesis is some phytochemicals will exhibit favorable PK properties and CNS penetration, indicating a potential KGP inhibitors. Material and methodology. Materials first, I will just take around 2000 phytochemicals compounds retrieved from MBD3 databases. Then on the second step, the pharmacokinetic and toxicity will be evaluated. Such parameters like water solubility, human intestinal absorption, permeability, steady state, volume distribution, plasma protein bind, cytochrome P450 substrate, and cytochrome P450 inhibitors, beside the hepatotoxicity. Compound demonstrate favorable absorption, adequate blood-brain barrier penetration, minimal cytochrome inhibition, efficient clearance, and absence of significance of toxicity alerts will be prioritized, and then going for the second step. Second step is oral bioavailability in silico. The physicochemical descriptors will be computed using Molino aspiration servers, and there's many criteria will be actually evaluated, such as log B, PSA, and non-hydrogen atom count, molecular weight, hydrogen bond acceptor, hydrogen bond donors, rotatable bond, and molecular volume. Also, they will be ranked according to Lipinski rules. Since the third criteria, actually, CNS specific profiling, since Alzheimer's disease targeted for just CNS, we need to target the CNS. CNS penetration will be the primary focus. Prediction blood-brain barrier permeability using PK CSM and validated with the Swiss ADM boiled egg models, which categories compound as PP blood-brain barrier permanent or non-blood barrier permanent. Fourth, data integration and prioritization. All predictive results will be combined into central data set, allowing to comparison across computational platform. A traffic light system will be followed. For example, go will be favorable, watch, that means a borderline, and stop if there's a poor result. We will just categorize absorption, distribution, metabolism, excretion, and toxicity profile. A composite scoring matrix will be prioritized compounds based on CNS penetration, MPO score, oral bioavailability, and lack of toxicity. Risks such as mutagenicity, hepatotoxicity. The final output will be is ranking list of phytochemicals that are predicted to have the optimal pharmacokinetic safety, CNS penetration, or characteristic. making them suitable for subsequent in vitro study for KGB inhibitors. The expected outcome is are identifying of top-ranking phytochemicals with favorable PK, CNS penetration and safety profile, computational shortlist for in vitro validation of Gingipain K inhibitors, potential discovery of natural KGB inhibitors for Alzheimer therapy. The budgets, the publication, and dissemination expense is around 10,000 RM, Malaysian ringgit, and Gantt chart first silicon toxicity. You'll find here as by days, and this is the reference. And thank you for your time.